How do we increase patient satisfaction in the hospital? The purpose of this project and our group's mission was to determine if the change to bedside shift report compared to traditional shift report could increase patient satisfaction rates at St. Catherine of Siena Hospital. Hospitals' profitability are now directly linked to patient satisfaction scores, as reimbursement is now 70% based on patient outcomes and 30% based on patient satisfaction. Pay-for-performance reimbursement is changing the healthcare system. Currently, St. Catherine's satisfaction scores related to communication fall below the national average. Therefore, for this project, St. Catherine's Hospital fits the theory we intend to test. We chose to focus our research in the ICU, which is a 12-bed unit. This led us to formulate background questions, which led to a clinical question. Do ICU nurses implementing bedside shift report compared to traditional shift report increase patient satisfaction to greater than 90%? Bedside shift report is exactly what it sounds like, taking the shift-to-shift report to the bedside and including the patient and the family in the report. This helps to give patients an active role in their care and empower them. A sense of teamwork is then established. Once we established our research question and decided upon where we're testing our theory, the next steps was to search the databases to find the best evidence-based research available. As you can see in the Prisma diagram, an extensive search was done. Keywords were used when searching the databases. To retrieve the most current relevant evidence, only articles in level 1 through 3 of the hierarchy were evaluated. Initially, 203 articles were reviewed. We did a title and abstract screen and were able to eliminate 147 of these articles. To filter the remaining articles, inclusion and exclusion criteria were used as limiters. Then a full text screen was done with the remaining articles. This resulted in 5 articles that met our criteria. These were then analyzed and synthesized to extract common themes. The evidence consistently told us that BSR, bedside report, is recommended to increase patient satisfaction. Other benefits of bedside report discussed include increasing staff satisfaction, decreasing falls, decreasing overtime pay, and better communication between healthcare team and the patient. This resulted in safer quality care. All of the evidence reviewed showed positive correlation between patient satisfaction and BSR. Most of the evidence reviewed was from a systematic review, and populations in the trials matched our PICO population. A limiting identified factor was that one study's population was different from our PICO population. Therefore, the strength of the evidence is not very strong, and we would need to test BSR in a small pilot study to determine if this change will have a similar result in our ICU. Our project team recommends that BSR be tested for usability in the ICU before further spread of this change. The first step is to contact nursing education, risk management, and performance improvement representatives to consult them regarding proposed changes in procedures and IRB approval if needed. No potential harms were identified in implementing bedside report. After necessary approvals were obtained, educating staff on research regarding BSR and how it can increase satisfaction scores, along with decreasing errors, decreasing falls, and increasing the transparency of communication, which will also lead to safer care. A lead RN will be appointed to each shift to help guide staff and assist them to moving to BSR. Posters and signs about BSR will be displayed on the unit to disseminate research and rationales prior to initiation of the BSR. Feedback about concerns will be addressed to help decrease resistance to change. The staffing ratios should be adjusted when BSR is rolled out. To evaluate our change satisfaction scores for 3 months prior to the study will be reviewed, and then after the BSR rollout, another review for 3 months of these satisfaction scores. We also can use our sister unit CCU as a control group to compare our scores to their scores. They are also a 12-bed critical care unit. After completing this study evaluations, we believe that we would have enough data from patient surveys to either prove or disprove our hypothesis that patient satisfaction can be increased by moving shift report to the bedside. If we find a positive correlation between BSR and patient satisfaction in our ICU, we then may spread this change to other units. Sustaining the change is important. Reinforcement of BSR is important, and follow-up feedback from patients and staff. Staff compliance should be monitored to be sure that BSR is actually being utilized. Leadership support is needed to sustain any change to support staff and provide boundaries if there are outliers who are resistant to this change. We also demonstrated how a similar hospital increased their patient satisfaction scores by implementing BSR. This is displayed in the graph. In conclusion, Changing shift report from the nurse's station to the bedside is a direct aim to meet communication goal for 2015 established by the Joint Commission. By moving to bedside shift report, we will improve on patient-centered care. We believe that the evidence is strong enough to warrant a pilot study in the ICU. The evidence showed an overwhelmingly positive outcome to BSR with no identified potential harms.